try and get the rest of our community on board over the next few minutes. So welcome to the August 20th meeting of the Gravity Project public group. We are very glad to have you here. Due to the large number of attendees, we always mute participants upon entry, so please remain muted to avoid background noise. For those of you that are accustomed to our calls, you'll be aware that we have lots of conversation though, so we definitely let folks know when it's time to unmute so that we can have a chat about something, and we extensively reference the chat during the presentation to ensure we fold ideas in. So please send chats to everyone, and then just know that there's a lot of conversation there as we go forward. Next slide, please. I didn't introduce myself, sorry, at the 4 o'clock hour. So again, my name is Sarah DeSilvi. I'm the Director of Clinical Informatics for the Gravity Project. You'll be hearing my voice throughout, along with my colleagues. This is our antitrust practices slide. This is a requirement as an HL7 Gravity, HL7 Accelerator project. Next slide, please. We always start here at the beginning of the presentation. So welcome any new voices, any new folk. There's a lot of conversation throughout the presentation on kind of catching us up as best we can if you're new to it, and there's always overview slides at the end of the presentation. But the core of our project is the Confluence page that's managed through HL7. We invite you to officially join the project after the presentation or even during the presentation by following this link. If you might have already joined, there's a way to see that here in this next link. And then, as always, the Confluence is a perhaps dizzying array of accomplishments and projects and status updates. So that's where you can go to get a general gestalt of the project. Next slide, please. These are our growing list of our local founders we're very grateful for. If you wish to become a sponsor, you can always follow the link, or if you want to connect us to an organization that you feel like it would be good to sponsor, just please let us know. We are a funded organization, the work of our colleagues, as you can tell. Next slide, please. And that was this one I preempted myself. So this is the this is the slide about connecting to sponsorship. And you can always just write gravityproject@emiadvisors.net if you have an inquiry about sponsorship. Next slide, please. We do have social media presence. Myself and the PR team are on there on a regular basis. You can find us both on Gravity Project at LinkedIn and the Gravity Prog on Twitter. Our Evelyn Gallego, who's our program manager, is also extensively on both as part of her group EMI Advisors. Next slide, please. Evelyn, segueing over to you just to speak about the next 2 slides.
Sure, thank you, Sarah. Good afternoon, everyone, and welcome. I'm Evelyn Gallego, the program manager for Gravity. So I help connect the dots through our work streams. Sarah will talk about our work, reminder what they are. So one of our work streams is the technical work stream, where we are working on developing the fire implementation guide. So we want to remind our community that we are participating. Actually, we're leading a Fire Connectathon track at next month's HL7 virtual Connectathon. So we invite you, calling all the implementers on the call, to please sign up and participate. We want to test what the technical team has firstly been working on for the last couple of weeks, making changes. The goal is to test the Gravity use case 1 and use case 3. So we have different activities, but that's really around the screening, observation diagnoses, and then the data aggregation. So I think they're figuring out, trying to get that ready for testing. It will be a true Connectathon, not education based. So please sign up if you can. And of course, you're also welcome to join as a participant if you just want to follow what's been going on to inform your testing in January. So Connectathons happen 3 times a year. We will also test in January when we will ballot. Next slide. So we announced this during our last meeting. So some of you may have already seen ONC's big announcement about collecting public submissions for the US Core for Data Interoperability, USCDI. Please peruse the announcement. We invite the community. So for those that have participated and are have contributed to the data elements, please do submit them following the very detailed process that they have for submission. We do also recognize that there is interest from the community of being involved in a letter. So we want to acknowledge that we will be we are working on a letter right now that will be as a supplement or as an attachment to the Gravity submission. So if you are interested in supporting that or having your name added, please let us know. We just want to acknowledge the community at large, but if you specifically want your name included, please reach out to us. And with that, I think that's it. Any questions before I hand back to Sarah? Okay. All right. Thank you. Back to you, Sarah. Oh, wait, sorry, one more. I forgot about this one. So for again, COVID has shone a very like a magnifying light on this work and really propelled the interest in collecting data to not only address COVID-19 needs, but really it highlights the need to have a big picture view of both the health and social needs and social risks of our communities. So HHS has stood up a new COVID site. So please see the link there, SDOH for COVID, Crowd City. So they want to collect, you're going to be seeing a lot of information through this website already. So really they want to connect the SDOH data to COVID-based interventions, community-based and clinical. So please peruse the site, contribute if you can, and watch what comes out through there. Next slide. We also have a challenge grant announcement from the Administration of Community Living, ACL. So their letter of intent, they have several grants available to entities to test. So in it, the challenge grant is around testing the referral from clinical and community-based organizations, and it does call out the Gravity identified standards. So please take a look at it. And the questions, I think Amy's email is amy.patel, I think, but it's on the link there. So questions, she is receiving questions. And we from the Gravity Project want to encourage you, if you're interested in this work and can and have the technologies, to apply. Next slide. All right, back to you, Sarah.
Hi, so back to me. As you can see, there's a lot of me talking, so I'm hoping you all will join me. I just wanted to give a kind of orientation to what's coming up next, both by going through the agenda and by just doing a kind of level setting. So we just finished announcements. I'm going to go through project roadmap and upcoming schedule. We're going to discuss some findings from the end-to-end review of housing instability and homelessness. We have an announcement regarding upcoming voting for housing instability and homelessness. We're going to give an update on some inadequate housing data concepts. And then, believe it or not, some transportation pre-work. So as you can see, at this point in time, there's 3 different domains that we're talking about at once. So we have housing insecurity, which we divided up into phase 1 and phase 2. So phase 1 being housing instability and homelessness, and phase 2 being inadequate housing. And then we're already at a point where we have to start looking forward to transportation. So folks who are new to the call, or folks who are just kind of needing to figure out where we are in space and time, that's our work for the day. I do want to welcome anyone and everyone. As you can see, the next slide is we discuss homework and next steps at the end. But at the end of the whole presentation, as I mentioned earlier, there's always an orientation to how the whole process, like what end-to-end review is, what voting is, and how each of these steps interact. So if you have questions, you can definitely review those slides at the end. And then, as always, you can always email me or anyone else on the team, and we'll be happy to answer any questions. All right, next slide, please. Okay, so here we are in space and time. It is August 20th. So we are at this time finishing up phase 2 of the housing and security work with inadequate housing and data element concepts and discussing transportation pre-work. The second column is always what we're asking folks to do, so the homework. The homework at this time is really just inadequate housing concept submission and transportation concept submission. The housing instability and homelessness work is all punted back in the hands of the SMEs and the terminology folk, Linda and myself. So we're busy working and reviewing all the comments from the end-to-end review, but you guys are off the hook for a little bit. You can see, though, as we segue into the next weeks on September 3rd, you'll see that we're going to start voting for housing instability and homelessness, and we'll cover that in this presentation. And then keep on going with inadequate housing and transportation. And then on September 17th, we kick off the transportation domain with our subject matter experts and start focusing on that work tangibly. So if you need to reference these slides, they're always on the Confluence, and then we always have this time frame on the Confluence as well, if you want to figure out, again, where we're at and where we're going. So we try to update this as well as we can, given some slight adjustments sometimes in the schedule because of risks that we encounter as we're building. Next slide, please. This is, again, just a reference. So Evelyn mentioned this earlier. We level set as much as we can throughout this because folks do come and go. So we do have 2 wings of our work primarily. So one of the wings is the work of language development, the development of the things that we need to say and the collation of things, of data concepts that already exist and the data concepts we've built into master data sets that represent the domain at hand. All of those steps are detailed on the left-hand side of this little infinity wheel here. We use those data concepts to develop coded value sets that are published in VSAC, and the value sets is what integrates and relates most tangibly to the technical work of developing the standard through HL7 FHIR. But it needs to be said, and it's hopefully represented here, because of how interdependent these works are, we're communicating constantly back and forth, and many of the folks on the call can testify to that. Next slide, please. Any questions on the schedule or on the visual or on the plan? All right. Okay, next slide, please. So we try to bring back any resolved comments on the end-to-end review to the community to keep you abreast. Understand these comments are just the next step. They've been refined and they're not finalized. We will finalize any comments before the voting begins in just a couple weeks. Next slide, please. So again, this is the housing data element submitters. It's a little, there's some folks who are not on here because there were a few new submissions to the housing instability and homelessness data set through the end-to-end review process. We will update the slide as best we can with those submitters. Next slide, please. Again, this is a table that's probably well known to you. It has to do with the submissions we received in the formal brainstorming part of our work, and just kind of goes through the different sections of activities we divide our work into. So we have screening tools and questions, diagnoses, goals, and interventions. Eric's asking a question about SDOH ontology. We're gonna, we do have lots of conversation regarding ontology, and I would say that's work to be done. One of the things that Gravity has a hard time doing is necessarily developing completing all the labor at once that needs to be done. So Eric, we'll reach out to you. I think we have about 6 folks or so who've mentioned wanting to be part of that work. So we'll keep you on that short list. Next slide, please. So I do try to level set again on the purpose of what the end-to-end review is. So we all go through a brainstorming phase with every single domain, and the brainstorming phase is just basically proliferation. And then the end-to-end review is a time to basically ask ourselves questions about whether things are missing, whether things are incorrect, and if anything needs to be removed. We have a new process which any of our submitters or community can be asked to reference, which is basically a change log that we're keeping. So every single change to the master from the point of end-to-end review begin to end-to-end review end is now in a set Excel spreadsheet, so we can reference it at any time. So if anyone wants to understand the evolution of the data set, we have that information available now. Next slide, please. So here are some key updates to housing instability and homelessness, and I do want to restate that caveat that these things are in process. They're in response to comments and conversations that happen outside of these calls. So nothing is final. And even I do want to mention, you'll see it later, that even in the consensus voting process, we can still make comments on build. But since we last talked, there have been some changes, and the changes can be noted in the red bold elements here. So just to orient folks who might not have been in the call, so the grand domain bucket is housing insecurity. What we have proposed so far is to divide housing insecurity up into two different concepts here. Again, we're not talking about inadequate housing in this bit. Inadequate housing would be part of housing insecurity, but we'll talk about that in a few minutes. But regarding housing instability and homelessness, we have homelessness and we have housing instability housed, right? So, and then within homelessness, you can see anything that's in bold, we are asking for it to be built both into ICD-10-CM and into SNOMED. And anything that is just unbolded will be just in SNOMED, but underneath the parent of the concept above it. So with that frame of reference, these are the changes. So last time we presented this information, we had housing instability housed, and housing instability housed, rent strain was here. And then what happened is we had some really interesting comments from the literature and from researchers and from community members about the tension between housing cost strain and housing cost burden. So after great conversation and needing a definition that could be understood, the SMEs are suggesting the evolution of the concept of housing cost strain into housing cost burden with a qualifier of severe, because that is clearly defined in the literature. So severe housing cost burden is defined as an individual who greater than 50% of their income is allocated toward housing costs. And this is where we see many of the significant healthcare associations. So the suggestion of the group in response to the comments of the community was to change it to this to be clearer and to be more clearly defined. I can answer any questions about that. And again, this is a work in progress, but this is the suggestion as it stands right now. The next change you can see is in response again to comments from all of you, or many of you, I should say. We had a really robust conversation the last call on the complexities of saying history of homelessness. So the suggestion from the subject matter experts after great conversation was really to reference it as a positive look back as opposed to a history of. So similar to other mental behavioral concepts such as depression, which is a 2-week look back on the PHQ, or many of the DSM-5s, or even the historically driven functional bowel disorders, you always look back over the last 6 months, or 2 weeks, or 12 months. There's always a period of time that defines risk. So our suggestion is to rephrase history of homelessness to say clearly homelessness in the past 12 months, because that's kind of that is a very clear affirmation of what the risk is without entering the complexity of history of. So we have a question from John. What strikes me is that many of these are secondary or indirect indicators to a primary indicator, such as job loss. Is this done deliberately? I guess my answer to that is what we know of social risk is they're all interdependent, and certainly the set that we've been doing so far, food insecurity, housing, and transportation, are driven and related to concerns of poverty and income. So I wouldn't say I wouldn't say that interdependence is done deliberately, but it's done considerately. We understand how interrelated these concepts are as best we can. And we have a lot of conversation about how to frame interventions with this in mind, because sometimes intervening on one concept within that alleviates a financial strain on the whole income of the household, and it actually can address another concept, like signing someone up for food stamps or signing a kid up for free and reduced school lunch might reduce the cost burden of the family to such a degree that they can get gas for their car, for example. So I guess I would say we recognize the interdependence and have considerations about how to operationalize them. And I hope that answers your question. And then Mark is saying, oh, John says, thanks. And then Mark says, what's primary and what's secondary may also depend on the use case. True. And it also depends on the wishes of the patient and the person. So we definitely try to consider the social need and identified desires of the patient in all of our work. Any questions? Can you please restate what will be submitted? Yes, I can. So to clarify, everything on this page, the intent is submitted to SNOMED CT. Well, and with some caveats, because it might not be homelessness, it might have to be refined into, I mean, some of these things we'll have to add unspecified codes to and build out according to the needs of the taxonomy and reference. But only the things in bold will be submitted to ICD-10-CM for US use. So for instance, there would be a housing instability housed parent code in SNOMED CT. And then these would be the children of that code. Is that helpful? I hope so. Yes, okay, great. Any questions on this slide? It seems like there's surprisingly not so much conversation, so I am gonna, for the sake of time, try to keep on going, and you can tell I try to read the chat. Next slide, please.
Sarah?
Yeah, hi, Lucy.
Hi, Sarah. Hi, everybody. I would say that you have really listened to this group and really tried to capture very succinctly a huge spread and scope of conversation the last 2 or 3 meetings. So maybe that's why there's so little conversation going on now, because we're all happy with what you've done.
Ah, that's good to hear. We are. That's great. And it's interesting because we've been talking with the SMEs a lot. At least I've been talking with the SMEs a lot about how sometimes this stuff just has to settle in your mind for a while. Oh, happy. That's great. And then you slowly can discern what needs to be said. And that is not, it's kind of inscrutable that process, but I'm glad it's feeling correct. All right. So thank you, Lucy, as always. And I'm glad it feels like consensus work, because that is indeed the intent and our design, I should say. We put this slide up here just for reference, because some of the updates that are coming next are regarding the intervention build. And if anyone was new to the group, I wanted to let you know and remind you of the intervention activities that we use in reference to all of our programs and people and professions. So just for reference, we have these interventions of assistance, coordination, counseling, education, evaluation of eligibility for, and then evaluation and assessment, provision, and referral. So part of our work last year was to coming to consensus on these activities, integrating them with definitions of some of the coding terminologies we work with, and coming up with new definitions when necessary, for example, coordination. But this is appropriate because as we go forward onto the next slide, you can see so some of the comments, end-to-end comments, meant that we had to add interventions, and then we also had to go through many of our programs and make sure they were correctly linked to interventions. I had a great deal of help with this from the group from the HMIS HIT subcommittee. Have these interventions been approved by LOINC or others? Yes. So the interventions as defined are in alignment with SNOMED CT definitions. Even the only time we did not agree is with education. So we dropped off the tail end of the education definition because of some, I would say, intellectual stubbornness on the part of many of the researchers in our group, and I would be one of them. But to large degree, yes, SNOMED CT is aware, and we directly referenced their literature, and everyone is on board so far. And if not, if I'm speaking incorrectly for many of our coding partners that are on the call, please let us know. But we did try to match what's published within their work. And then, okay, so with the previous slide in mind, we went through all of our programs and redefined them. And then this next bullet is what I was talking about. So one of the comments from Dr. Kelly Duran, who's a researcher in homelessness, was that it seemed incomplete, some of our pairings of activities and programs. And sure enough, we had not correctly filled out a lot of, or correctly matched some of those activities with our program pairings. So we went through and revised all of that. We also, that work again was assisted greatly by Gabe, Kate, and Susan Walker, who are colleagues that we've made through our HMIS HIT subcommittee. So thank you, Gabe and Susan. We added a program type of medical respite, and we added an activity of coordination of services to assist with maintaining housing security. So this was a comment that you guys, I think, might remember from previous calls, a need to represent the activity of assisting patients to maintain housing placement. This is a unique problem when it comes to qualifying for housing programs. Sometimes you keep someone in a housing program by addressing chronic health or mental or behavioral health concerns. So that ongoing labor, we heard it early in our work, and we also had heard it from some of our wonderful housing experts that we sat with one-on-one. So we came up with an activity to represent that. Lucy John says medical respite, know this, how is it defined as different than hospice? So medical respite in this case is, there's a fair bit of literature regarding this. It's primarily the discharge of a hospitalized patient who was previously homeless or housing unstable to a stable housing situation in order to recover and heal. And it can be done sometimes not after a hospitalization. It's primarily done after a discharge. So this is different than hospice. This is a homelessness or housing instability intervention, and we've yet to define it. We've had it come up with from our end-to-end reviews. So the literature has many operational definitions, and we're hemming and hawing that. And I do believe actually Joellen from UHC proposed it as well. So it literally synergistically came from 4 different places at the same time. So sometimes it's, there's many different facility types. Lucy's asking what sort of facility would that be? Like, for instance, in my city, there's a contract with a local community, like a housing trust and a local hotel that facilitates those kinds of discharges. There's actually an interesting use case with COVID. I mean, I don't know if you'd apply the instances of discharging folks to stabilized housing in the presence of a COVID diagnosis to this program or not. Oh, and look, thank you. Look at that. Medical respite care. Thank you so much. So again, we're in the process of creating the standard definition, but that was a notable absence from our program. So we definitely needed to add that and did so. Great. The next thing is, as I mentioned, so what end-to-end review does is it adds, it changes, and it removes. We've had no removals. We did have to change something though, and this was again through the astute eye of Monique van Berkem, who is a colleague from the American Medical Association and a key conduit between the terminology work and the standards work, and she's on the call, so thank you, Monique. So it was noted that health risk assessment was capitalized as a program in our interventions work, and the reference that was cited for that capitalization seemed to reference the limitations of the Medicare annual wellness visit health risk assessment, which is a specific thing. That was not the intention. So what we've done is revised it to be assessment of health risk and assessment of social risk. And again, these are terms that are in development. The reason to do that is to have it better correlate to the CPT of 90461 and 90460, which are I think those are the codes off the top of my head, which are the health risk assessment CPT that are utilized appropriately in this instance for a social risk assessment. So that is our change at this time. And then we have, can the definition of different, this from hospice be? Yes, it will absolutely be included. So it's wanting, John Snyder is wanting us to clarify the definition of medical respite as differentiated from the hospice respite is going to be part of our definition submitted to SNOMED, and absolutely it will be, 100%. Any questions on this slide so far? No, okay. Here we go. Okay, next slide, please. And then I just, fantastic. So I brought this back up for Donna, Rug, and Lucy. So this is kind of this is a word cloud we made before, and I think it's all starting to gel. So I'm grateful for everyone's work on the housing instability and homelessness data set. It definitely feels like we're getting there. So thank you. I think we're going to have a product that everyone's feeling ready about voting on the 3rd of September.
Sarah?
Yeah?
I think we're all looking forward to rent burden going up in smoke. In other words, no longer being an issue.
No, I love it. Thank you, Lucy. Thanks, Lucy. That's great.
Visuals bring up thoughts like that.
I know. I love it. Wonderful. Okay. Next slide, please. I think we've covered questions so far, but any other questions? Question, where does social isolation fall into the assessment of social risks? Yes, so social isolation and intimate partner violence and kind of the interpersonal social risks, either the absence of relationships or the complication of relationships, those are all on deck to begin in Q1 of 2021. So we have them in our sites. We are collating the right subject matter experts to assist us with that work, but yes, we're on it. We just keep on, oh, fantastic. So just a note that we need to reach out to you, Francis, to make sure, and I'm sorry that I don't know your first name from the call, but we'll reach out to you and find your email. If you could actually email EMI, that'd be great. And the email is at the end of the call, the end of the slides. So next slide, please. So housing instability and homelessness consensus voting start date. Next slide. So we just want to remind everyone that we are a consensus initiative and why consensus voting is important. So consensus relies on due process to allow equity and fairness. It supports open participation, a balance of interest, and equal opportunity for all participants without any dominant positions. It's important. Consensus voting provides the opportunity to address all views and resolve any objections so an agreement can be reached. Next slide, please. So after we finished our brainstorming work with housing instability and homelessness, we are in the process of revising all submitted comments from end-to-end review. We begin voting on the homelessness and housing instability data set on September 3rd. We'll vote for 2 weeks. And then it's important to note that all committed members vote and everyone counts, and there's a quorum that we seek in order to make sure that we get to consensus. So these are the different votes: yes, yes with comment, formal objection, or abstain. This is a link to the consensus process you can find on the Confluence. We will have to extend it if we don't get enough committed members voting. So please, committed members, take an effort to review the data set and vote on it when it's released on September 3rd. We'll go more in depth about how to do so and how to vote on that call. But I just wanted to make sure everyone's aware that coming soon to an inbox near you is a need to vote on the data set for housing instability and homelessness. Next slide, please. Again, questions on that part I think are probably best saved for the 3rd, or looking at the confluence. Expert, lovely. Thank you for adding an expert for social isolation. There was actually a really amazing presentation on loneliness on Here and Now today that I was listening to, and got all kinds of things popping through my head. Okay, next slide, please. Update inadequate housing data concept submission status. This is actually quite brief because we are actively in the brainstorms period on inadequate housing on a few issues, so there's not much to report right now. So next slide, please. This is our submission status. Again, it looks slim, but it's because many of the inadequate housing concepts we have came from submissions from our colleagues in other domains, and we've just rolled them over. This is what's represented here. Next slide, please. This is, again, our framing so far, just for people who are new to the call. We're trying to revise it to reference substandard housing, or housing that's not meeting habitability standards, because many of our conversations have revolved around the regionality of assessing housing adequacy, and wanting to ensure that there's some kind of anchor of reference when you're making that assessment. Again, I always talk about the Hawaii pest comment, that bugs in Hawaii in your house is not as much of a problem as it might be in other places. Again, these are our suggestions. This is very much a work in progress, and there's a lot of conversation happening over the next week on interventions. We have lots of meetings planned. So next slide, please. Again, this is the framework for how to submit data submissions. We ask for screening tools, assessments and diagnoses, goals of care, and interventions. I'm going to remind everybody, we really are actively seeking inadequate housing. I know it's hard when we're doing so many domains at once right now, but just to remind folks that we look for program names and definitions, we look for providers and practitioner roles, and we look for any direct activity or service. Again, the master set is starting larger and larger, because as we recognize key programs for one social risk or one housing element, we roll it over into any other appropriate domain. Next slide, please. I just wanted to specifically highlight the interventions work here. We really are part of my meetings over the next week are trying to address really how to describe the activities of addressing inadequate housing in different communities in ways that are agnostic to the community, like trying to come up with the meta concepts about what one does and who one would refer to. So if you have any housing experts, inadequate housing folk that you feel like we should have a one-on-one with in order to solve this sticky wicket, please connect me with them, and I would love to have a conversation. So we recognize that right now the interventions element of the inadequate housing data set is not complete, and we're actively working on trying to finish it. So if anyone has ideas or people who I should talk to, just please let me know. My email is always at the end of the presentation, and you can find me through the Confluence as well. Oh, lovely. Thank you, Lucy. Lots of social isolation things coming. I think social isolation in the pandemic is definitely an interesting concept, so it's definitely apropos. Okay, next slide, please. Again, this is one of the slides we include. It basically describes some of the questions we ask ourselves as brainstorming. We try to take on and off many different hats to ensure that we're not just provider-centric, that we're thinking from the patient perspective, the CBO perspective, from state perspective, from the system perspective, and definitely from the provider perspective as well. Next slide, please. Any questions there? Again, we are full on brainstorm right now for inadequate housing, so there's not a ton to report there. If there's no questions, I'm going to move on a bit to transportation pre-work. Next slide. Oh. All right. So we had a wonderful meeting with our transportation SMEs. These are kind of our anchor SMEs. And SMEs stands for subject matter experts for those who are new to the work. We kick off transportation in a month-ish, right, to 4 weeks. So we have Alexandra King. I don't know if she's on the call. She's transitioning from the Community Transportation Association of America into grad school. She's quite the expert on the intersection of health and transportation needs. And then we are very lucky to have Jennifer Sisto-Gall as well from Lyft. She brings a policy lens to the work of transportation needs and has some informatics experience as well. Lucky us. And they and all of their networks are connecting to some additional folk who will help us in that work. And the reason why we're bringing this to you now is the expectation, the hope is that prior to starting any domain, at this time, like a month ahead of the domain, we ask you to submit transportation concepts. The goal is to start with a good set right off the get. So we have set up the transportation domain Confluence page already. Anyone can access the how to submit data concepts Excel spreadsheet on the Confluence. If you are at all confused, you can always just email myself or anyone on the Gravity EMI email team. And we just want to get started brainstorming. So if you have any ideas, again, across any of the elements of screening, diagnoses, goals, or interventions, ready, set, go. And then we'll spend about 4 weeks not really talking about transportation, and then circle back around for the kickoff on September 17th. And an important thing as well is we really hope that for the transportation work, which takes about 3 months, and again, it's all staggered, so we'll still be talking about inadequate housing then. We hope that our community, as we have it right now, will have an influx of transportation-minded individuals to help us with this work. So even if they're not subject matter experts, if they're CBOs who are working on the ground, or they're subject matter experts that don't have the time to be a SME on the project, but just want to come and help on the community calls, please go out and find your people working in this domain and at least try to get them to the public calls, so that we can collectively have a body that's able to take this on starting September 17th. Lucy's asking, public transportation, no idea of expert, but that modality has to be in our sites. Yes, so Lucy has 2 ideas. Yeah, so we had a very pointed conversation about rurality and urbanity and elements of transportation access on the call on Tuesday with the subject matter experts. We definitely want to try to make sure that we have folks from both. And thank you, Lucy. Rural healthcare associations and associations are a great way to go. So thank you. Okay, next slide, please. Any questions on that? Okay, so just I'm going to level set everyone. Yes, Lucy?
Sarah, I guess would take too long to type this. One of the upside down things that's happened during this COVID pandemic that I have read about here in California is a wholesale reversion to preference for automobile transportation because people want to be in their own bubbles. Not to mention that public transportation has been drastically cut back because of crowding. So I guess I just want to introduce the idea that when we deal with transportation, from a social determinants of health perspective, we may end up having to cope with so-called normal times versus, I don't know, not normal times, and talk about whether not normal times should be embedded or at least acknowledged in how we think about transportation from an SDOH framework.
Lucy, I think I understand you, and I'm grateful to say that I already can attest that the subject matter experts are pretty innovative in what a new normal might look like. And I also just want to say we can't talk about social risk without talking about climate risks. So I do hope we endeavor to be curious about our solutions. And I promise, I'm encouraged by the conversations I've already heard so far, and I really look forward to working with this community to come up with answers to that, or at least questions together, and then maybe we can collectively come up with answers. Does that sound like a good answer to you?
Yes, great. Thank you.
Okay. Next slide, please. I think we're gonna end early, which, given that we just went through 3 domains, is actually really surprising to me. But we're yes. Thank you, Denise. Yes. This is the first subject matter expert meeting I've been in where so Denise is saying, I'm sure the SMEs know more about RHI reports. I'm using them to model telehealth interventions. When I was in the meeting on Tuesday, it was the first meeting I've ever been in where I only understood half of the acronyms. So usually with social risk, I'm pretty comfortable with acronyms, but in this instance, I will be sure that they are aware of that. But there's a lot of learning all around. And I'll make sure that we send that over to them. So thank you. Okay, next community homework and next steps. Next slide. All right. So in general, for anyone who's new to the group or just wants to take a meta view, you can catch up on materials and recordings on the Gravity Project Confluence page. Again, I want to restate and thank Highmark. We had a wonderful session with them on creating a public-facing web page that is a little bit more accessible, a little bit more intuitive. The Confluence will always remain the heart of the project, but it might not be the best way to find out about us as a new member. So Highmark donated an incredible day of expertise on web design, so we're grateful for them. Yes, and Ned's asking a question. I can do that, absolutely. And then housing instability and homelessness. So the master screening summary is up there, and you can review it. Again, we're not accepting necessarily formal comments on it anymore, but if you have anything late breaking, we'll definitely entertain it because we're very open. Inadequate housing, submit new concepts, and this is the way to do so. The Excel is downloadable from the Confluence. Again, focusing please on the interventions. This is where we're not woefully, I feel it and I know it to be true that we're not quite complete there, so it needs some of our attention. And then transportation, submit new concepts via the same pathway, the Excel spreadsheet, or if you just have an email idea, you can send it along. Thank you for an idea on climate as a health risk, and thank you so much. It definitely is lifetime work, but we would be remiss if we didn't keep that lens as we were doing any of the domain work, really. The intersection of climate as a health risk and all of this social risk we've talked about so far is painfully apparent. Next slide, please. And then we close here. So join the Gravity Project as a committed member or other interested party. Again, there's the link. I think we've shown it 3 times. Can you tell? We really love committed members. And then And then sign up as a participant in the Gravity Project SDOH Connectathon track. And then any update on convening the social needs platforms as a follow-up to the ACL challenge. Evelyn, do you want to state anything on that? It intersects with another initiative we have, so I'm going to try to see if Evelyn can give us a meta view on that.
We mentioned the ACL in the announcements. So the care, I think this was about this is just the Gravity track. We also have a care coordination track happening, but we are focused on care planning, so can pitch for that. I do see a question there, though. An update on convening the social need platform. So yes, so those, we are working on that internally. So we do want to reconvene all the community referral platforms that we invited to a meeting we had in May. We're still working through the Fire IG build and just getting us to the Connectathon on September 9th. So again, really the technical team has been heads down on that and really want to make sure we have something to test and validate in September. And then after that, we have to relook at, again, the goal from our timeline perspective. And I've got on my to-do list to update our timeline. We intend to ballot the SDOH Fire CC clinical care implementation guide in January of next year, January 2021. So we need to test here and we need to test again in January. So before that, we will convene and have more validation of what we're working on to inform what actually ends up in the final submission for ballot.
So Teresa, did that answer your question? Maybe. If not, if this, yes, thanks, great. Sarah, can you provide me a couple of examples of housing interventions so I can look to people who might be able to help out? Thank you. So this is in reference to the inadequate housing section of the housing insecurity work. So the question is really, so if we as yet do not have program types and professions and people that are a sufficient number to cover the breadth of things we do to address inadequate housing or housing quality issues. So if we actually go back, to that the inadequate housing ICD slide, if we can, Sarah B. I'm sorry, I know it's going to take a few minutes, but probably not. There we go. We're almost there. Thank you, Sarah B. Okay, stop here. You're amazing. Thank you. So good. So if we think about each of these subtypes as a subtype of housing, inadequate housing, pests, mold, lead, temperature control, storing and preparing foods, lack of smoke detectors, lack of potable water, and overcrowding, right? There are interventions, programs, people, professions that we connect individuals to address each of these subtypes, right? So this is an instance where there's many different things we do because there's many different types of substandard housing, right? So there's meta concepts like community action agency or, area agency on aging that might be able to facilitate connections to individuals or to programs. But if there's specific program types or kinds of activities that we use to address these things, we really don't have them covered yet. So when we're thinking about interventions for, sure, exactly. And then when it comes, so someone says Baltimore Housing Mobility Program, and then in all of our work, because we're national, for instance, with Baltimore Housing Mobility Program, it reminds me of the work we had to do with Benefits Data Trust, right? No, I think that was it. Because things are getting a little muddy in my head, right? But we can't use any proprietary terms. So we're national, so we have to think about a meta term that describes what that organization does. Like even in healthcare for the homeless, we have to think about a meta term describes what that program does. So the best answer, yes, exactly. So we have a rental assistance concept in our housing instability element. And maybe rental assistance is also a good program to address any of these things. It's possible. But maybe maybe there's other programs that are specific just to inadequate housing that might be more appropriate. So that is the question: is what are the programs that one would connect an individual to address these concerns? And even if you submit just the proprietary program, we can extrapolate out to the meta, because then what we can do is work with subject matter experts to come up with something that might be a national representation of the same thing. Yes. So John, thank you, John. Substandard housing due to inability to store food or prepare food would not be, yes. We definitely are in the winnowing process of this. And so John is a representative from SOMA. Thank you so much for coming. And we definitely, we do try to not let anything come to you until we've addressed these problems. So thank you so much. Any other questions before we go on? Is the directive clear? So I hope by landing on this slide and answering that question, you can see that the idea is to address all these things. So if we address all these things, we need a way to address them. So the programs, professions, and people that might help us with them, we're going to want to know what those are. And then, okay, so I think that this was the last, I think the slide we went back from was the final slide. If there's not any other questions, I think, there we go. So thank you, everybody. Any other final questions? We have a few minutes. Again, John, thanks for coming in and keeping us on target. I think we addressed everything in the chat. I did try to link the health risk assessment codes, and thank you so much for your time. I gave you back 3 minutes. Everyone have a lovely Thursday.
Thanks, Sarah.
Thank you.